Let's now move on to skin conditions. Sorry, it makes me flick through every time to get to the section that we need to get to. Section 7, skin conditions, the juicy stuff. Just kind of want to say before I just go over some of the manual that there are tons and tons of skin conditions that we will see, we'll talk about, we'll hear about, we'll come across. Don't worry if you don't understand everything straight away. It does come with practice, time, experience, and research. So if you see something and you're not sure what it is, don't worry. Take a picture, send it to the clinical oversight, ask us, do some research. What I would say with skin conditions, there is never too much research that you can do. Get some skincare books, join Facebook groups about skincare. And honestly, the more research you can do, the more it will just be etched into your head. I would say as a practitioner, it's important to have a basic understanding of skin conditions. I am going to go through the common skin conditions that we'll tend to see kind of daily within the jobs that we are in. Another point that I'd like to make is we will see some skin conditions that will contraindicate the treatment. So let's say, for example, if a client has a cold sore or they've got impetigo, which is a contagious skin condition, we are unable to treat them, would contraindicate them, and we would then recommend that they pop to the GP or to the chemist for some medication. We are not medically trained, or I'm not medically trained, and a lot of you won't be medically trained, so we are unable to give advice on medication. So you will always make sure that you refer them to a GP, to the chemist, or to a dermatologist, rather than diagnose ourselves. We can give advice, but we cannot medically diagnose or recommend medication. So let's just go into this a little bit and discuss some kind of skin conditions or conditions that we may come across as therapists. So skin cancer. Skin cancer can be visibly obvious or hidden in plain sight. And when we're talking about skin cancer in terms of us looking at the skin, we're thinking about moles generally. There's a course, you can get some courses that don't cost too much, but there are a few free courses that are floating around. If you want me to send you the link, I can send you the link, that give us some knowledge around moles that may not look completely normal and could potentially be cancerous. If we, as a practitioner, come across some of these moles, then we want to be saying to our client that nothing necessarily to worry about. However, this mole looks like a slightly different shape or a slightly different colour, might be worth just popping to the doctor. So common skin conditions to be aware of. So I'm just going to read through some of these slightly for you. So acne vulgaris is a skin condition that develops when the hair follicles become clogged with dead skin cells and skin oil. Blackheads or whiteheads, pimples, greasy skin, and potential scarring are its defining features. Rosacea. So rosacea is a common rash that typically affects people in their middle years and appears on the centre of the face. Following an easy tendency to flush, little inflammatory red pimples and pus-filled spots appear on the cheeks, chin, forehead and nose. So there are various types of rosacea which we'll cover later on in this section. Sebaceous cysts, a bulge or bump under the skin, known as a sebaceous cyst. Folliculitis. So folliculitis is an inflammation of the hair follicles. Usually bacterial or fungal infection is the culprit. Impetigo, superficial skin is affected by the bacterial infection known as impetigo. Herpes, cold sores. I mean, most of us are going to know what herpes and cold sores are. It's a viral illness known as herpes simplex. All herpes affects the mouth or face. Small blisters and clusters, often known as cold sores or fever blisters, may develop as a result. So it's important to know some of these skin conditions, which conditions can be treated and which can't. Impetigo, herpes are highly infectious, so they would be contraindicated, for example. And then we've got hyper and hypopigmentation. So hyperpigmentation is the little brown areas of the skin. Hypopigmentation is when you get white areas of the skin. And generally pigmentation is caused by damage. So it could be sun damage, it could be picking, spots, various things to include. So post-inflammatory pigmentation, let's just have a little look at this. So history can include infestation, allergic reactions, mechanical injuries, picking acne lesions, reactions to medications, burns, bruising. So all of this can cause pigmentation. This type of pigmentation can darken with exposure to UV light, so hyperpigmentation, and with the use of various chemicals and medications. So dermal pigmentation caused by trauma, this just explains a little bit how pigmentation works. So a combination of the inflammatory response and ultraviolet causes the inflammation to disrupt the basal cell layer. A combination of melanin pigment being released and subsequently trapped by macrophages in the papillary layer. Once the wound healing is completed and the junction repaired, the melanin and pigment granules caught within the dermal layer have no way of escape, and that's a more difficult type of pigment granule to eliminate. So that just kind of explains how pigmentation works to an extent. So post-inflammatory pigmentation is a darkening of the skin that's the result of trauma, for example. Then we've got hypopigmentation. So what is hypopigmentation? Hypopigmentation is a low amount of melanin in your skin. Patches of your skin are lighter in colour than your surrounding skin. Your skin, hair and eyes get the colour from a chemical called melanin. When your skin cells don't make enough melanin, areas of your skin become lighter. As these injuries heal, scars may develop that are lighter than the surrounding skin. So what can cause hypopigmentation? Burns, infections, blisters, chemical exposure, or rare genetic conditions may cause hypopigmentation over wide areas of your skin. Acne. We all know what acne is. So there are various stages of acne. We've got comedones, pustules, papules, which are all names that you'll hear, which are also known as blackheads, spots. So we know what blackheads are, we know what whiteheads are. Acne vulgaris is a term used to describe generalized acne, which is what we've just discussed. The severity of acne and symptoms are often graded into 4 stages. So you've got grade 1, which is generally kind of smaller blackheads and whiteheads. Grade 2, papular acne, which is inflamed, blemish, red lesions that appear on the surface of your skin. So generally when they're a bit red, a bit pussy. And then you've got grade 3 and grade 4, which are fairly severe. I mean, generally if someone is grade 3 or grade 4, we're not going to be treating them with facials. Scars. There are various types of scars to be aware of. We can definitely treat clients that have scars. We can give a standard facial. When you start to do the more invasive facials, we can actually help to combat and reverse scarring. But it's worth just having a rough idea of certain scars. So there are 3 main types of acne scars. So we've got ice pick scars, rolling scars, and boxcar scars. So you'll see the little pictures in the pink diagram here. So an ice pick scar, first one here, or the second area, small deep holes in the surface of your skin that looks like the skin has been punctured with a sharp object. So sometimes you'll see clients and it looks like you've just picked a blackhead and there's just a little hole there. That's an ice pick scar. Rolling scars caused by band C-scar tissue that form under the skin, giving the surface, the skin, a rolling and uneven appearance. And then you've got boxcar scars, round or oval depressions or craters in the skin. And then we've got keloid scarring. So keloid scar is when your scar keeps growing and becomes bigger than the original wound. So keloid scarring is quite common. And imagine, you cut your skin and you've got teeny weeny little builders inside the skin and they're repairing. But they don't stop at the skin surface. They just carry on. So the scar sits outside of the skin. And in terms of facials, this is fine. But when you start to look at more invasive treatments, keloid scarring would actually be contraindicated. Rosacea. So rosacea is a non-contagious chronic inflammatory condition characterized by sporadic heat, flushing, persistent erythema. So erythema is redness of the skin when blood comes to the surface. True rosacea only affects facial skin beginning around the nose, then expanding into the bilateral butterfly pattern across the cheeks. That's meant to be 2 words, pattern across the cheeks. In the most severe cases, rosacea may then spread onto the forehead and chin areas, also in bilateral appearance. Rosacea does not generally affect the body. I mean, in terms of rosacea, there are various types of rosacea. You have like a cystic rosacea or a standard rosacea. And for me personally, I really do believe that gut health can affect rosacea. And if you work with your gut health, you can absolutely help symptoms of rosacea. So there are 3 traditional types of rosacea that may be diagnosed on the skin. So the types are listed here. I'm not even going to try and say some of those words, but you've got papulopustular, phymatous, and then the erythemal, that one, which is chronic inflammation. Scientists don't know what causes rosacea, but there are a number of theories. They know that inflammation contributes to some of the key symptoms, such as skin redness and rash, but they do not fully understand why inflammation occurs. However, if you do have clients that are coming in with rosacea, I would discuss gut health with them. Aging skin, collagen glycation. I mean, generally, this happens as we age. The number 1 cause of intrinsic, so systematic skin aging, results from a process known as glycation. Glycation occurs when sugar molecules bind and attach to collagen protein fibers. The subsequent release of AGEs, advanced end glycation products, create the cross-linking of protein strands. This reduces collagen and elastin production. The appearance of glycation is characterized by quilted or crisscrossed wrinkles. These become most apparent on the cheek, eye, and neck areas. This is generally what you'll see in your more mature client. Cherry angiomas. So these are really common, teeny weeny little kind of red areas. I mean, I personally have them on my chest. I think I have one on my cheek. So cherry angiomona, also known as angiomona, cherry, senile angiomona, Campbell-De Morgan spots. So it's a non-cancerous skin growth made up of blood vessels. They're fairly common. They can occur anywhere on the body and are most common after the age of 30. They usually don't need to be treated. However, if they do bother a client, then they can be treated via burning, freezing, laser, or shave excision. And then we have got spider veins, which are just worth noting. These can also be treated through kind of laser therapy. And we actually got through that a little bit quicker than I thought. How long did I talk about skin conditions there? For nearly 13 minutes. So I'm going to end this recording and then we'll go on to skin types and analysis in the next section.